Yes, ma'am.
Okay, timer is on, and
Yeah.
here is the question. Right, so if you have read and understood, kindly tell me which region is this that you're looking at? This green
Ma'am,
one. A.
okay. It is the dorsal aspect of our right hand, and it's indicating the first dorsal interosseous space, ma'am.
What is another name for this space? Is there any other name? Not this one. Okay, this red one, please. Can you tell
Yes,
me?
ma'am. This
Yes.
area is, yeah, this area is called, ma'am, anatomical snuff box, ma'am.
What are the boundaries of this area?
Ma'am, anterolaterally, there will be two tendons like abductor pollicis longus and extensor pollicis brevis, and it's a triangular space.
Yes.
And posterior medially, there will be only extensor pollicis longus. And its base is formed at the level of the styloid process of the radius, and apex is formed distally by the meeting point of three tendons. Roof is formed by skin subcutaneous tissue, and floor is formed by scaphoid and trapezium bone, ma'am.
Okay,
And also part of the styloid process. Yeah.
Can you tell me what are the contents of anatomical snuff box?
Here it lies actually the radial artery and also the radial nerve, ma'am. And at the base, it contains the scaphoid bone, ma'am.
What is the dermatome of D area?
Ma'am, the D area is dermatome C8, ma'am.
Yes, good. Okay. Can you tell me what are the tendons which pass over first the attachment of flex extensor retinaculum?
Okay, ma'am. There are actually 6 compartments, ma'am. From medial, from lateral to medial, first compartment.
First attachment. Extensor retinaculum is attached from where to where,
yes,
please?
Yes. The extensor retinaculum actually attached medially by the scaphoid and medially by the base of the distally, medially and distally the base of the first metatarsal and proximally the styloid process, and laterally it's bounded distally by the base of the fifth metatarsal and proximally by the lower end of the actually ulna.
Yes.
Ulna it's medially, ma'am, and laterally it's the radius. Yes, and a structure found below the extensor retinaculum from lateral to medial, it would be a first compartment. There will be, ma'am, abductor pollicis longus and extensor pollicis brevis. In second compartment, ma'am, extensor pollicis longus. Third one, ma'am, the extensor carpi radialis longus and brevis. Then lies the extensor digitorum and extensor digiti minimi, and the last compartment it contains, ma'am, the extensor carpi ulnaris.
Can you tell me any test which can be done to confirm the collateral circulation of the hand?
Yes, ma'am. It's actually called the Allen's test, ma'am.
Very good. How do you do that?
At first, I'll ask the patient to elevate his hand and make a fist for 30 seconds. And during that time, I'll just occlude the radial and ulnar artery, both of the hand. And then I'll ask ask the patient to open the fist. I'll see there will be paleness or blanching at the palm. And I'll just then release one of the artery. Like at first, I'll check for the ulnar. If I want to check for ulnar artery, I'll release ulnar artery, and there will be reappearance of the of the circulation in the hand within 7 seconds. That indicates the circulation is intact from ulnar artery, and we can again repeat it for radial artery also in the same way now.
Okay, can you tell me how superficial palmar arch is formed?
Yes, superficial palmar arch mainly is formed by the most contribution from the ulnar artery, like 60 to 70% comes from ulnar artery, and from the medial region, there the ulnar artery divides into two branches medially over the hypothenar muscle. It is superficial and deep branch, and the superficial branch actually forms the palmar arch, and also a branch from the radial artery that is called superficial palmar branch of the radial artery.
Okay, just suppose
Laterally.
this patient, very good. Okay, just suppose this patient presented with a pain between his thumb and index finger of the right hand, just suppose.
Yes.
And there is, can you tell me why, what is the significance of tenderness in the anatomical snuff box? What
Yes,
does
ma'am.
it signify?
Mostly it indicates there may be fracture of at the wedge level of the scaphoid bones. So there may be pain in the anatomical synapse box region, and mostly it occurs whenever there is any indeterminate force is applied to the patient violently, and most of the cases it contains the medical legal importance for
Very
the
good.
scaphoid fracture.
Yes. Okay. How scaphoid fracture is diagnosed? What?
Ma'am, scaphoid fracture is diagnosed actually anterior-posterior view of the hand X-ray with
Okay.
ulnar deviation position, ma'am. In that way,
Does it
scaphoid fracture
always
is.
show in the images?
Sorry, ma'am.
Is it always visible in the images?
No, no, ma'am. So most of the like in it may be also be missed in the images, ma'am.
Yes,
It's
it can
not
be.
always diagnosed, ma'am. But if the pain persists for a long time, actually,
Yes.
that gives a suspicion there may be a fracture and avascular necrosis of the scaphoid bone in the
So why
proximal portion.
does avascular necrosis of scaphoid occurs?
Okay, ma'am. Scaphoid bones actually
Yes.
it's wedge shaped, and
Yes.
it's the two limbs actually located proximally and distally.
Yes.
So it receives most of the blood supply from the lateral and lateral and distal part of the radial artery in a
Yes.
retrograde portion. Like the distal artery gets first the blood supply, and the proximal part depends on the retrograde flow of the radial artery. So whenever
Good.
there is wedge fracture occurs, so the proximal portion is neglected and it may undergo avascular necrosis, ma'am.
Very good. Okay. Right. What is malunion of? Okay, we'll do this first. All right. Can you look at this X-ray A and identify A and B in this left-hand side picture?
Ma'am, A is ma'am scaphoid bones, ma'am, and B is the lower end of the radius.
Okay.
Actually,
C, please.
C is the ma'am first metatarsal bone of the right.
Okay. D, please.
D, ma'am. Okay, I think it's lunate, ma'am.
Yes. And E, please.
E is ma'am lower end of the lower end of the
How many carpal bones are there?
metacarpal.
How many
Ma'am, there are
carpal
actually
bones?
8 metacarpal bone, ma'am.
How are they arranged and what are they called?
They are actually, ma'am, arranged in two rows, ma'am, proximally and distally. And from in the proximal row, from lateral to medial, there is scaphoid, lunate, triquetral, pisiform, and the distal row from lateral to medial, it will be trapezium, trapezoid, capitate, and hamate.
Okay, can you please tell me if there is injury of radial nerve at the wrist, what would it lead to, the injury?
Ma'am, it may cause paralysis of the wrist extensor. So inability to, there will be wrist drop and inability of
At wrist,
finger
yes.
paralysis of the finger extensor that may cause, ma'am, the finger drops also, and also there will be loss of sensation at the first wave space, ma'am, and the
Okay.
distribution of radial nerve
What
area
are the
of the hand.
movements which are present at the thumb?
Yes, ma'am. There are actually several movements. At first, ma'am, there occurs flexion, extension, flexion at the palmar plane also, and radial extension or radial abduction. There may be abduction, adduction, and opposition, ma'am.
Okay. Which nerve is more important for the thumb?
Which nerve? Yes, ma'am. Yeah, the anterior interosseous nerve is more important for the thumb, for a branch of the median nerve.
Median. Okay. Why? It's just the opposition which
Sorry, ma'am.
is
Anterior interosseous and both the recurrent one.
yes.
Yes, ma'am.
Yes.
Thenar muscle supply. It supplies the
Just
thenar
the
muscle.
median, yeah. But other muscles are dependent more on the radial, like extension and abduction, radial abduction.
Yes, ma'am.
Very good, well went. Okay, good,
Thank you, ma'am.
excellent. It was random station for you. You didn't know this. Note which one? Dr. Suman is telling someone.
Sorry,
Hello,
ma'am.
ma'am.
I told
Good evening.
it's metatarsal. It's metacarpal. Sorry, ma'am. Yeah.
Did you say metatarsal?
No.
Yeah, ma'am. Slip
No.
of
Actually,
I wasn't.
I was talking about escaphoid, lunar, tricutular, and pisiform. These are carpal bones.
Yes.
These are carpal.
These
Yeah,
are
yeah,
not
yeah.
meta.
And Dr.
Yeah,
Rupata was saying like I
that
told
was
the first metatarsal. So that's why, yeah.
It's okay. Slip of tongue. Slip of tongue. It's
Yeah.
okay.
It's
You did
slip
good.
of tongue, just slip of tongue. Yeah, he
Yeah.
did
You
great.
did good.
He
Dr.
did good
Abhishek, you
actually.
did really good.
He passed.
Yes, ma'am.
It
He
was a
passed.
random
Yeah.
station for him, and an anatomical snuff box is frequently asked. So this station is worth
Yeah, ma'am. Shoulder
Yes.
practicing.
joint, anatomical snap box. These things
They
are
are,
their favorite. I
they are
heard
asked
that. Yeah.
various
Yeah.
times.
Yes. Shoulder and hand. This is the
Yes.
commonly. Yes.
Yes, hand examination.